Hello, this is Dr. David Greene, CEO of the Nevada Pain Network. The topic today is what you need to know about acute and chronic back pain. Over 90% of Americans will experience back pain at some point in life. And regardless of whether or not any treatment is sought, 90% of those will get better within 6 to 12 weeks. Unfortunately, a few patients will end up with chronic back pain. Acute back pain is noted as 6 weeks or less, subacute is 6 to 12 weeks, and chronic is defined as over 3 months. Back pain is the second most common reason for doctor visits, just behind the common cold. Half of all working adult Americans admit to having back pain each year. It's the most common cause of disability worldwide, and the direct and indirect costs all total in America is $100 billion, an unbelievable, staggering sum. So what are the causes of back pain? Well, what I've done is broken them down into 3 types: soft tissue, bony tissue, and then the uncommon causes. Well, the most common cause by far for soft tissue injury is a back sprain or a strain. This can be from anything: sports injury, car accident, just trying to lift a box to move, and you either sprain a ligament or you strain a muscle. And usually those get better within a few days to a few weeks. But that's the most common cause. Then you get into the disc degeneration. A normal disc is what you see here on the left. You have the outer covering, which is called the annulus fibrosus. There are nerve endings in here, so if you have a tear or degeneration, it can be painful. This inner gelatinous material is called the nucleus pulposus. There are no nerve endings in here at all. Okay? Here's a view from the side. You can see these are the bony vertebrae, but the discs, the soft tissue between the discs that are the shock absorbers, here's a healthy one. It's nice and plump. Then you start to get a moderate amount of degeneration where you start to lose height, you lose water, you get some bulging going back. It just looks kind of ratty. But then here is severe. I mean, you can't see barely the disc at all. Okay? So you have some bone coming back from degeneration as well, and that can cause some nerve root pinching. So you start looking at bulging discs, tears, and herniations. Here's a disc looking down on it. It looks pretty normal, actually. You have the annulus fibrosus here, the gelatinous inner material. But you see these tears and fissures here? Those can be very painful. Okay? Now, if the disc starts to bulge more and more, and it can actually have some of the inner stuff herniate out and pinch on a nerve, that's a herniated disc, and that can cause sciatica. So here's what you see is multiple nerve roots coming out of the back come together and form the sciatic nerve. If you have one being pinched up here, it can actually cause pain going down all the way down the leg and the back, or maybe the side or the front. Just depends on which nerve root is being pinched. So here you have a disc looking down on it. You have a bulging from degeneration. The bulge itself can push on a nerve root. Okay. Now moving into the harder tissue with arthritis. Arthritis is the most common cause of just generic good old back pain. Okay, you start to get bone spurring from the degeneration. It can be a combination of disc degeneration that leads to degeneration of what's called the facet joints in the back of the spine. But that can cause pain every day. It can cause pain that waxes and wanes. It may cause no pain. Just because it looks terrible on an x-ray doesn't mean much. It might not cause any pain to the person. Sacroiliac joints, there's 2 of them, one on the right, one on the left. Can't see the other one, but they have cartilage just like any other joint. There is a little bit of movement in this joint, and it can be very painful. Up to 25% of low back pain is actually pain coming from a problem in the SI joint. Okay? Scoliosis. A lot of people think of scoliosis as just in kids, right? They think of adolescent idiopathic scoliosis. Well, no. Adults can get scoliosis too, even if they haven't had it at all as an adolescent. What you see here is the discs may start to degenerate. You get arthritis in the back of the spine, and unfortunately it's not symmetric all the time. So you might get more degeneration here, and it ends up kind of degenerating and forming a concave curve, and then where you have the convexity on the other side. Okay, so that can be very painful. It can cause patients to limp and have to bend over when they walk. Spondylolisthesis is a fancy word, but all it means is spine and then slip. So you have one level slipping on the level below, and that can lead to arthritis, degeneration of the disc, pulling on nerve roots because you're actually separating the two. So it can be a very painful situation that may end up at the end of the day requiring surgery, but oftentimes it does well with steroid injections, physical therapy, and whatnot. Spondylolysis is actually a fracture. It's a bony fracture of what's this area here called the pars interarticularis. It happens most often in people who do repetitive activities such as gymnastics, football, other sporting activities. It turns into a stress fracture here. Usually it doesn't require surgery. You can do well with non-operative measures. Spinal stenosis results from spinal arthritis. So here we're looking down on a vertebrae. Here's the spinal cord in the back of the spine. But you see how arthritis has caused bony overgrowth where the nerve root is trying to get out and it's pinching on it? That's really spinal stenosis. It can cause pain in the buttock area, thighs, down into the leg, and the arthritis itself can cause a lot of back pain. Okay, so those are the main causes. The uncommon causes, they're not the focus of this talk, but infection can either occur in the disc itself or in the bone. Fracture, where you see a spinal compression fracture here, most often happens in people who have osteoporosis and insufficient bone density. They can get a fracture just from sneezing or a minor fall. Okay, and then a tumor could be a metastatic tumor or a primary tumor such as multiple myeloma. The top pain management clinics in Nevada are Nevada Pain. There are multiple locations. They accept over 50 insurance plans with the board-certified doctors. The doctors have won the Patient's Choice Award 5 years in a row. The number to call for scheduling is 702-323-0553 or visit us on the web at painmanagementlasvegas.com. I'm Dr. David Greene with the Nevada Pain Network. Your pain stops here.